With Michigan now under a state of emergency, we know you have a lot of concerns about what you can do to keep yourself and your loved ones safe. That's why we have set up a special phone bank staffed with experts to answer all of your questions. We certainly set it up last week. It continues this week. Our Heather Catallo joins us now from our phone bank. And Heather, I know you are practicing social distancing there in the studio. We're really doing it all over the station. So if you see us today apart, there's a reason. We're supposed to stay 6 feet apart in order to stay safe with this coronavirus pandemic ongoing right now.
Yes, it's so hard, Carolyn. Obviously, we're all so used to being in close quarters with each other. And of course, I want to get over and talk to each of these doctors, but I'm going to stay right here. The phone number is 248-827-9200. Please send us your questions. We're trying to talk fact and not fear, but we all have so many questions. We're going to start with our chief health editor, Dr. Partha Nandi. You know, we've seen a lot of reporting about these symptoms of coronavirus. We say a lot of people have mild symptoms, but sometimes mild can include pneumonia.
Correct.
So what exactly are we talking about?
So symptoms that everybody talks about is fever, shortness of breath, and a cough. Now that's a lot of different illnesses can have that, but if you have that, then you need to call your doctor. Don't show up at a hospital or your doctor's office. Call your doctor's office and figure out if you need to be tested and self-quarantine until you can actually get tested. But it's fever, cough, right? Fever, cough, and shortness of breath. Those are important, the triad, to really look forward to. Unfortunately, lots of other illnesses can have it, but including the coronavirus.
So, and we're talking dry cough, correct?
It can be dry, but it's variations thereof. You know, I don't think we can just say if you don't have a dry cough, then it's not coronavirus. If you have a cough, fever, shortness of breath, then get help right away.
Let's talk also too about runny nose, because it's allergy season, right? And we see people with the tissue, we're like, oh my goodness, what do we do? Is that a symptom or no?
It can be. It's any upper respiratory tract infection signs can be it, but lots of people have allergies, people have the cold, people have the flu. But here's the thing, if you have any doubt, go get some help. This is not the time to try to, use Dr. Google to try to figure it out. You got to get some help because this is something that we want to contain.
And let's talk about immunity. If you get coronavirus, do we know if you're going to be immune from it in the future?
And we've had other coronaviruses, Heather, so we know that we can develop immunity. We don't know with this virus if you can. Chances are that you will, but we don't know because we don't have the information. Most people that recover don't get the illness again, but it's a small minority of folks that can get it again. So I think if you've resolved it within the 14 days of that you're quarantined, then you should be fine. But know that if you have symptoms again, you should go back to self-quarantine again.
Okay, and so I was going to ask Dr. Little another question, but she's on the phone helping people. So when we're talking about pneumonia shots,
Yeah,
I know some people
right.
have asked about that, and if you had the pneumonia shot, does that make us more immune to this or no?
The simple answer is no. It doesn't help you with the coronavirus, but you should still get the pneumonia shot because it protects you from what you're supposed to not get, which is pneumonia, but it will not help you with the coronavirus, unfortunately. But what does help is staying healthy, like we talked about, washing your hands, using this. If you can't wash your hands, staying away from sick people, and get sleep and get adequate nutrition. Really important to boost your immune system.
All right, well, we're going to let you get to the phones.
Absolutely.
I know so many people have questions. Once again, that phone number, 248-827-9200. We're going to keep the phones going all evening. Carolyn, back to you.
Yeah, we so appreciate all of our doctors being at our phone bank. People have so many questions and so many fears, so that helps so much. Heather, thank you for bringing it to us from Studio A over there.